Good evening, namaskar, and a very warm welcome to all of you in this live interactive session of ours. Where at the 8 p.m. session, Indian time, we are having our live session primarily for our international viewers from UK, US, Canada, and the European countries. And as I always say, your questions are our priority. But before we start with the questions, always remember, autism is a temporary phase in the life of a child if treated timely. That if is really very important. Many a times when we talk about autism, a lot of time is wasted in accepting that the child is autistic. Many a times, even when we start with the treatment, when the parents come to us, they waste a lot of time in understanding that along with the medicines, the herbs, the food supplements which we are providing to their children. More importantly, along with that, the ABA, that ABA which was developed by me in my research, it's not the normal ABA which is done in the psychotherapy centers. That particular kind of ABA training for the parents is utmost important. Now, if that is not done, it's only partial recovery that is achieved. But when both those things go hand in hand and the parents work with us as a team, the results are astonishing. And then autism becomes a temporary phase in the life of a child. So before we go ahead, I would be taking your questions directly. And as is always promised, the platinum members for our YouTube channel, their questions are presented to me in the form of a history. So whenever a platinum membership patient shares a question with us, it takes me a bit of time, around a minute of time, to concentrate to see what exactly has been forwarded to me in the history. So we have our new platinum member, Mr. Sandeep, with us, and the question is, he needs more focus, having hyperactivity, we need to reduce vision, eye corner issue, and speech and other problems. So while I analyze the history provided by you to your coordinators, Tarun, all of you, please be with us. I'll just be going through the history of this patient, and while I discuss the case which is being forwarded by Mr. Sandeep, there will be many things which will be common for your children also. Stay with us for this small break. I'll be right back once I analyze the history. Sandeep ji, I'll be back replying back to your questions. Stay with us.
Hello friends, greetings. Also want to stay fit like me, then you should try Wrist Pushed, and my trust has been strengthened by Dr. Navdeep Sharma. Just as I have defeated wrestlers and made India's name ring out across the world, in the same way, Dr. Navdeep Sharma's Wrist Pushed Ayurveda has driven away every disease. Once again, the flag of good health has been raised high. Hello friends, greetings. I am the great...
So welcome back. So I have the entire history with me in this case. Sandeep ji, the name is Manvit. So when we talk about Manvit, you started treatment with us in January 2025, and Manvit is 6.8 years old boy. When I talk about the hyperactivity, he can sit up to 30 to 40 minutes now, and at times if he gets irritated, he hits other. Name response has increased a bit, now it's 8 out of 10, but it is sometimes delayed. Eye contact is for 7 to 10 seconds, now it is improving a little bit. Command following is better. When we talk about speech, the number of words now are more. Amma, Appa, Kodu, Kannada words are more, and they are partially clear. When we talk about visual sensory issues, the corner gaze is reduced, and then tactile sensory issues are sustained. Hearing sensory issues have improved by 70%. Oral sensory issues have reduced by 80%. Attention and concentration is now 10 minutes for selective activities. Sitting tolerance in writing is for 30 to 40 minutes, and toilet he is partially trained, not completely trained. And the most important thing which we are yet to focus is the memory. You are worrying about his memory, that definitely shall be taken care of. Another important aspect which I can see over here is the number of sessions. The number of ABA sessions are lesser than what is required over here, and that is a common problem which I see in most of the patients. Since we are already getting improvement and we are getting improvement in many aspects, I am very sure that once the ABA sessions are done twice a week under our ABA expert, where we are guiding you and you are getting it done for your child, you will definitely see the improvement which is already coming, even quickening up in this case. And as I can see, Brenoir, cucurbit oil, mukta pishti and jetamansi oil are the ones which are being given. So currently I am pretty much satisfied with the supplements and the medicines which are being given to you. So Shiropichi should not be missed in this case. That should be done regularly, and ABA now needs to be done at least twice a week. That is very important. And whenever it's possible for you, whenever you feel that he has or you have some break, you're always welcome to step in to our Chandigarh Panchkarma Center, which is an NABH certified center. The best part of coming to Chandigarh Center is that once you are getting an in-house treatment over there, you can claim that treatment at most insurance companies, making it easier for you as a family to bear the expenses of the treatment. So I hope that provides you the satisfactory reply to your question. I'll be moving to the next question. Mr. Joshi, you are a new member for us. Namaskar, sir. Vishrut is 6.5 years. His voice is slow and less concentration. May please guide to raise the pitch of voice and concern. Right now, he is continuing ABA sessions and taking medicines, Brenoir Plus, cucurbit oil, Sarsaristam with gold. As per guidance, he is continuing the hurdle jumping, crawling, palm walking, sir, up daily basis. May guide us. And I have been told that Rahul is the one who is doing the sessions for you. But unluckily, the sessions are only 4. We are from Odisha. The major thing which we require over here is we need to increase the number of ABA sessions, and over here, since the pitch of the child is less, we shall always also be required to do some sessions under Dr. Samriti Sidhana, our speech expert. So you can get back to the team. What I can do for you is, see, you are giving Brenoir, you are giving cucurbit oil, you are giving Sarsaristam with gold. The most important thing which I can do for you is I can include those, I can ask the team to include the speech session, which is a special session, along with the ABA sessions, so that it becomes more affordable for you. So you can get back to the team. Along with the Rahul sessions, you shall require sessions from Dr. Samriti Sidhana. And please be more consistent with Rahul's session. At the same time, since you are our silver member, there are multiple sessions which are done on this channel itself. Don't miss those sessions. There, the therapists, they guide a lot of things to the patients, making it easier for those who are taking lesser sessions. रविंद्र चौहान जी, नमस्कार सर. भावना के चेहरे पर दाने दाने से निकले हुए हैं. कहीं ये दवाई का साइड इफेक्ट तो नहीं है? हम 24 जून 2025 को चंडीगढ़ ओपीडी में मिले थे. कोऑर्डिनेटर नवनीत मैम है. सम्मिष्ट तेल से सर की मालिश कर रहे हैं. ज्योतिषमती तेल से आप सर की मालिश कर रहे हैं. जब मौसम बदल रहा है करें या बंद करें? आप बंद कर दें सर. एक्चुअली होता क्या है, जो ज्योतिषमती तेल जब हम बच्चे के बालों में लगाते हैं तो कई बार बच्चा तो बच्चा है, बच्चा अपने बालों से वो तेल जो है वो फेस पे लगा सकता है. तो इसमें 2 से 3 चीजें की जा सकती हैं. एक, थोड़ा सा हम ध्यान रखें इस चीज का, और ज्योतिषमती तेल बिल्कुल सोने के समय लगाएं. एज अ पेरेंट थोड़ा ध्यान रखें वो फेस पे ना लगाए. हर बच्चे में तो नहीं, लेकिन जिसकी पित्तज प्रकृति है उसमें अगर ज्योतिषमती तेल बार बार फेस पे जाएगा, हल्के फुल्के दाने हो सकते हैं. हालांकि उसका कोई नुकसान नहीं है, लेकिन अगर ऐसी कोई प्रॉब्लम आ रही है सो प्लीज आप उस केस में ज्योतिषमती तेल कम लगाएं या फेस को और बेटर तरीके से साफ करें. रही बात फेस पे अप्लाई क्या करना है, सबसे सस्ता, सबसे आसान तरीका मुल्तानी मिट्टी का पैक, और नागार्जुना कंपनी का एक साबुन आता है जिसका नाम है इलादी सोप. जो इलादी सोप है वो मेरे ख्याल से 30 या 32 रुपए का एक साबुन है जो इलायची से बनता है, वो बहुत लाभकारी है। इस केस में आप इस्तेमाल कर सकते हैं। रिताक्षी शर्मा जी, गुड इवनिंग सर, पेशेंट कोड you have mentioned Satvik, coordinator name Nitya. Sir, currently he is consuming too much water, nearly 1 liter a day. If it can create any problem, not at all. Let him take as much water as he can. The only thing is, just before the meals, try diverting his attention. If he takes, say he has to take a meal at 1 p.m. and he takes a lot of water at 12:30, that will cause a bit of appetite issues in his case. Otherwise, there is no harm in taking a liter of water for the child. Let him do that. Going further ahead, the next question which I can see over here is from Sweetie Ji. And Sweetie Ji, you are a new platinum member, and that means that for you, I have to analyze the complete case as is our protocol for all our platinum members. So, for all our viewers, I'll again be taking a small break of a minute while I can analyze the case shared by my doctors in case of Sweetie Ji. So, Sweetie Ji, please be there with us, and all of you can be there with us. I'll be right back after this short break while I analyze the history forwarded my way in case of
Hello,
Darshini.
friends, greetings.
So,
I am the
yeah,
great
I'll
Kali.
just be doing.
If you also want to stay fit like me, then you should try Wrist Pushed, and my trust has been strengthened by Dr. Navdeep Sharma. Just as I have defeated wrestlers and made India's name ring out across the world, in the same way, Dr. Navdeep Sharma's Wrist Pushed Ayurveda has driven away every disease. Once again, the flag of good health has been raised high. Hello, friends, greetings. I am the great Kali. If you also want to stay fit like me, then you should try Wrist Pushed, and my trust has been strengthened by Dr. Navdeep Sharma. Just as I have defeated wrestlers and made India's name ring out across the world, in the same way, Dr. Navdeep Sharma's Wrist Pushed Ayurveda has driven away every disease. Once again, the flag of good health has been raised high. Hello, friends, greetings. I am the great Kali. If you also want to stay fit like me, then you should try Wrist Pushed, and my trust has been strengthened by Dr. Navdeep Sharma. Just as I have defeated wrestlers and made India's name ring.
So, welcome back. And before I go, Sweetie Ji, to this case of Yatra, I was just got a chance while I was analyzing this case to have a look at Bhavna. So, yes, the forehead is currently having a lot of small pimples over there, and now that is not due to any oil or due to any medication. It is a bit of infection that is there on the forehead, which generally occurs in the rainy season or the season after rains, where the moisture is more. So you will need a antibiotic ointment or a good ointment for application over there. You can get it under the guidance of our pediatrician. You can ask the team, they can connect you to our pediatrician, and you will be advised with the ointment which you can apply. So don't apply anything else, go for a proper ointment, because the number of pimples is too much. That cannot happen due to any medicine or any oil. So moving ahead, I just analyzed the case of Sweetie, and I will be sharing few details while I'll be guiding you. Nikhil is the coordinator, and the good thing for us is that 8 years and 1 month, when we talk about Yatra, I hope I am not pronouncing it incorrectly. Uh, he's not completely non-verbal. He has words. That is good thing. Otherwise, when people come to us, they will say that the child is non-verbal, and we have to work a lot on making the child as verbal. So it's good that he already is verbal, and I've also been updated. The major problem is the aggression. Explained aggression. Now, when it comes to explained aggression, it is a learned behavior, and we call that tantrums, like throwing books once in few months, lying on floor, crying, and then washing his face again and again and asking if he looks happy, as it avoids crying. And then the eye contact is good, the name response is 6 out of 10, the command following 2 to 3 steps of commands he can follow. He was non-verbal till the age of 4.5 years. Now, need-based speech is present in full sentences but lack of expressive speech. That generally happens when the conscious mind is working to a greater percentage than the subconscious mind. So definitely we will be working on that. Echolalia is there, imaginatory thinking and speech is present. That again is a good thing that he can use speech for the imaginative things. That is really very good. I can see some of you contributing for our channel. I really appreciate that. I won't be able to name you guys because I am busy in the questions, but yes, small contributions which you always do for our channel. See, it's not a matter of money. By the grace of Almighty, we are blessed with your support and we are having huge centers. They are really working very nicely. But these small gestures always make us feel that yes, we are going on the right track. And it is very important for us to understand, to know that the content being created by us, the way in which we are interacting with you is something which is being appreciated. So I really appreciate these small gestures. So going further ahead, and there is mild mouthing, there is verbal steaming, tactile sensory issues. Now what happens is when a child is not able to do expressive speech at the age of 8 years, mouthing, sensory issues are bound to come. So when we start working on him through our ABA protocols, through RABA protocols, you immediately will see these sensory issues going down. Definitely the calming herbs, the relaxing herbs, the positivity enhancing herbs which we shall be using for him will also be very good for him. But the best part is that along with this, the ABA techniques which we follow for your child at the age of 8 years, 1 month without any major medical problem. The only worrying thing for me is that you have mentioned something that there was a blue area for which you went for a stem cell therapy. Now I really don't know that what was that blue area. If there is something wrong with the PET scan, I would really appreciate if you can share the PET scan also with us. And once I'm there in UK, I'm planning to be over there in December, planning to celebrate Christmas this time around over there in UK. So all of you who are over there in UK, because my plans are for Europe, there are some meets in Europe. I thought let's take a break and at the same time, let's be ensuring that I catch up with all my UK patients. So December will be there for UK. So for those of you who are from UK who are joining us, it will be in the last part of December or in the first part of January that I'll be meeting you over there. You can get back to your coordinators for that. But till the time I am over there with all the details which have been shared my way, in this case, I would really suggest that Yatharth needs to be starting with Breno R granules, the hot chip Breno R's. That should be given all 3 times a day. Pumpkin oil is really very good for him. Mukta Pishti is good for him. And along with that, ABA sessions, the Breno R which I just am talking, you can see it on your screens now. This is the Breno R about which I am guiding you. Pumpkin oil, Mukta Pishti, and along with that, the most important thing, ABA sessions bi-weekly under one of our experts. So by the time I meet you in December, I really hope that things would have started going on the right direction. But the most important thing, don't miss out on the ABA part. The next question, Madhavji. The question is, लास्ट यूट्यूब लाइव पे सर ने ब्रेनो आर 10 ml 2 टाइम्स कुकर बिटा ऑयल 8 ड्रॉप्स 2 टाइम्स मुक्ता बिस्टी गाइड किया था एंड कुछ कॉस्ट इश्यूज थे बट आप ये दवाइयां लेना चाहते हैं तो मैं आपको बताना चाहूंगा सर देखिए सबसे पहली बात जो आपको याद रखनी है मेरा अपना ये मानना है अमीर से अमीर मिडिल क्लास गरीब से गरीब हर व्यक्ति का अच्छे आयुर्वेदिक इलाज पे हक है और हम ये सुनिश्चित करते हैं कि कोई भी व्यक्ति अगर हमारे इलाज के तरीके को पसंद करता है तो केवल पैसों के कारण वो इलाज से वंचित ना रह पाए फॉर माई व्यूअर्स इन इंग्लिश आई वुड लाइक टू रिपीट दैट आई ऑलवेज बिलीव दैट कॉस्ट शुड नेवर कम in between a good treatment for a child. So that is why we have separate departments. We are having a normal department which works directly under me, जहां पर हम वाकई में इस चीज की परवाह नहीं करते. We don't worry over there how much it is going to cost to the patients. We give the best things to the parents. The best things at times are expensive. But yes, the results are quickest, the child comes out of it. And generally that is done on direct video conferencing session or one-on-one meet session with me. But then there is a separate department, the department which takes care of group OPDs, the one which I am just doing now. We call us our YouTube live streams as group OPDs, where I take questions, I guide my team, my doctors and psychologists then get back to the patients and they can take the medicines. Some of the medicines which I use for my core patients are missing out over there because we need to be cautious about keeping that medicine in the budget of the parent. And then the third department, the charitable department. Again, what we do over there is we provide the parents with the herbs. They make the decoction and syrup at their own home. So we save from the processing cost, the manufacturing cost, so that if a person is having high financial issues, still the person can start with the treatment in our charitable department. And for those of you who cannot spend even a single rupee, a single dollar, a single pound, you are again welcome at our Amrit Center. You may be from UK, you may be from US, you may be from Canada, you may be from any country, you may be from India. Any one of you who feels that it's really very tough managing the expenses of the treatment, you are welcome at the Amritsar Center. The charitable Amritsar Center just needs to know that yes, you are genuinely poor. See, my friend, there is a lot of difference between being genuinely poor and in having the funds but feeling that why to spend so much on the medicines. Now, those of you who have genuine financial issues, our charitable department is welcome for you. And those of you who feel that if it's Ayurveda, why it's expensive? My answer is if Ayurveda has to be safe, if Ayurveda has to be herbal extract based, if Ayurveda has to be quick acting, if Ayurveda has to be working, if Ayurveda has to be FDA inspected, if Ayurveda has to be organic certified, if Ayurveda has to be GMP certified, if Ayurveda has to be NABH certified, believe me, it gets expensive, but at the same time, it is the safest. So, moving further ahead, the next question is from Miharbe Le Canadian. Again, my friend, you are a platinum member and you have just mentioned, hello, I am a new member. How do I share my child's case to you to study? And over here, I'll again have to take a break. But as I can see, do we have the details, Jovan, right now for this case or, huh? So, my friend, in this case, since the case is yet not compiled for me, you will have to share the details with us now, one of my psychologists and one of my doctors. It's just confused how to share a detail. How? So both of you are going, they are going to get in touch with you. You are not the one who needs to share the details directly. All that you are required to do is, you can see the number on the screen, you can see the email ID on the screen. All that you are required to do is, now this is something for all our platinum members. For those of you who are platinum members, what we do is, the entire case history is taken by one of our psychologists. Now that analysis is compiled and now an Ayurvedic doctor's takes the entire details. Now some videos we request the parent to share those videos. They again are analyzed by my psychologists and all that data can be shared by you on the WhatsApp number which you can see on your screen. And once we have your WhatsApp number, immediately my team is going to compile that data for you, not necessarily in this live because it takes a lot of time in compiling everything, but in my next upcoming live. Now that entire set of reports and details, they become available for me, and just you saw me taking breaks. I take a small break, I go through everything which is forwarded my way, and accordingly then I give my expert advice. So since we still do not have details from your end, don't worry, all your details are very important for us. Just send a message on the number, the WhatsApp number which you can see on your screen, so that my team gets back to you. So going further ahead, the next question which I can see, and yeah, there is a question which is a brief detail is shared my way, but I would like to have further details from my team. I would acknowledge the details which you shared. She's a female child, Jasmine, and age is 6.2 years. And Ibrahim, you are the concerned person who has joined with us. Lacking in understanding, speech missing only few words, not toilet trained, making sound, sometime jumps. So don't worry, I acknowledge these details. Let my team get back to you. Let us have all the details and the case analyzed, and you will definitely be guided for that. And along with this, a privilege which any platinum member has over here. So any one of you, any platinum member over here, for example, you take a platinum membership, we take your question, you discuss everything, and now you feel that you want a one-on-one physical meet as I am coming in your country, or you want a one-on-one video conferencing session, which generally has a wait time period of 1 to 3 months. All that you have got to do is you have to go back to your coordinator, you have to share with them the proofs of your membership, and whatever you paid for that platinum membership is automatically deducted from the registration charges for any of these things, so that you are not paying double for consulting your child with us. So you can do it in this group meet, taking the benefit of that through the platinum membership concept. You can always do that through the video conferencing or the physical meet concept. But in both those cases, do remember that at the age of 6.2 years, for a child like Jasmine, who lacks understanding, but yes, only few words are there. The child is not completely non-verbal. The child has few words. It is possible. Don't worry about that. Share the videos, share the details for me to be guiding you further. Samay. The next question is from Mr. Samay. Tarun is the coordinator. Tarunji, is it okay to teach Marathi, English beside mother tongue language simultaneously? How to increase his memory? How many times to teach anything as he is forgetting? So here, I would like to tell you that in case of Samay, since he is forgetting a lot many things, and at the same time, you are currently contending with brain OR. Yeah, there are financial concerns. So what I would guide over here is not something which is expensive. Saraswata with gold. Saraswata with gold is a syrup, very economical. You can add it along with the rest of the medication, only 2.5 ml to be given daily. So that will not over budget you. At the same time, it will help you. Another thing which you can do at your own home, petha, cooker bita. Petha is very good for your child. Use petha as a mithai, use petha as a juice, use petha as a vegetable in whichever form your child takes it, use it. And along with that, shiropichu is very good for your child. So don't forget to do shiropichu for your child. The next question is ID's lifestyle with mystery, and the coordinator is नमेहना. सर मेरी बेटी 8 साल की है, उसको नेफ्रोटिक सिंड्रोम है, उसकी मेडिसिन अमृतसर में चल रही है, प्लीज आपको सुजेस्ट करिए. नमेहना जी, विद ड्यू रिस्पेक्ट टू योर क्वेश्चन, मैं आपको बताना चाहूँगा ऑटिज्म में तो मैं बिना रिपोर्ट्स देखे, क्योंकि वो मन का रोग है, कुछ केसेस में ही मुझे जरूरत पड़ती है पेट स्कैन एमआरआई देखने की या क्रोमोसोमल स्टडी देखने की, मैं एकदम से कुछ बता सकता हूं. लेकिन नेफ्रोटिक सिंड्रोम में मैं आपका क्वेश्चन एक्नॉलेज कर सकता हूं. मुझे कुछ डिटेल्स चाहिए होंगी, प्रोटीन लीकेज कितना है, अभी क्या क्या चल रहा है, और मैं इंस्ट्रक्ट कर रहा हूं इसी लाइव के दौरान मेरे अमृतसर सेंटर इंचार्ज डॉक्टर शुभम को कि वो आपका केस मेरे साथ पर्सनली डिस्कस करें. एंड बिल्कुल निश्चिंत रहें, मैं 1 हफ्ते के लिए सिंगापुर में हूं. बहुत देर से वेट कर रहे थे कुछ लोग, वहां जरूरी था जाना. 1 हफ्ते के लिए वहां पे हूं. हो सकता है उस हफ्ते के दौरान अगर डॉक्टर शुभम मुझसे ना कनेक्ट कर पाए तो बहुत क्विक आंसर ना दे पाए आपको मेरे से डिस्कस करके, बट इमीडिएटली आफ्टर दैट आपको जवाब जरूर मिलेगा. लेकिन मेरी कोशिश रहेगी कि अगर उससे पहले मैं डिस्कस कर पाया तो पहले भी जरूर बताऊंगा. नेक्स्ट क्वेश्चन इज फ्रॉम राहुल वर्मा जी. Hello, sir. I am Divyam's dad. I have given Breno R in bottles twice a day by mistake. Hopefully, it is okay. If some have given in overdosage by mistake. Now, that is the beauty of the Ayurveda which we are using, Rahulji. And definitely, as a parent, if overdosage of a medicine goes in the child, you are bound to worry. But do not worry. The reason for that, these are so safe medicines that although the name is Breno, there is nothing which is sedating in it. So, there have been cases where a child accidentally drank the entire Breno syrup. The parents gave us a call. There was no problem that occurred. So, don't worry, even if you gave it in a double dosage by mistake, there is nothing much we need to worry in this case. Now, going further ahead, the next question I can see is from Dashima has given some details about Divyam. I would like to repeat those details that you started treatment after UK meet and in July ending you started it and the Brenoir concentrated hot sip DS and Mukta Pishti is going on. ABA is going on under Gurpriya and 6 sessions have been done. But the sessions are less over here and what I would really appreciate is since Divyam is 8.11 years in age, we either need you people to be doing it diligently and if you feel you are facing any challenge, leave it on us. Simply take a break for everything we are doing. Come to us for a few months. Let us do it for Divyam. Don't wait. At 8.11 years, Divyam is already at an age where waiting is not the right kind of a thing. So please either increase the sessions, start working more, or come to us and let us work over there in this case. Going further ahead, Sandeep ji, the question again, Tarun is forwarding your question, but unluckily, since the number of questions are too many, so I won't be able to take the question in this live again. But yes, definitely, my doctors will be getting back to me on the questions, and on my behalf, they will be replying back to your questions. Then, all the issues which you shared our way, like corner vision, speech problem, sitting tolerance, when I have guided the things, I am covering all those things. And do remember that along with the medicines, ABA session is something which should not at all be missed. So once again, I would like to tell all of you that when we talk about autism, autism is a temporary phase in the life of a child. The only thing which we are to keep in mind is that it needs to be timely taken care of. When I travel around the globe, there are multiple parents who will always say, who will always ask my team, is it really possible? I can understand that when Google says, no, it's not possible. When the psychotherapy centers around you say, no, it cannot be done. When the psychiatrist says, it cannot be done. The neurologist says, it cannot be done. The pediatrician says, it cannot be done. And when you have been to various homeopaths, Ayurvedists, naturopaths, a lot of stuff, it becomes tough to believe. But the best part is you only need to believe us for 6 months because it's only for 6 months that you need to believe on our words. And within those 6 months, by the grace of Almighty, we always achieve above the targets which we promise to our patients. So take the first bold step. Share the videos, contact, do not waste a single day. Life is precious. And once we believe that our child can come out of autism, the child is definitely going to come out of autism. Before I leave for the day, as I always request, your likes, your shares for our videos really mean a lot to us because when you are sharing the right kind of information to those around you, that is the biggest help you can do for others who are waiting just like you to see the first positive change in their child, to see the child come out of autism. Thank you for joining us. Have a good day. Bye bye.